So I'm Louise Emmett. I'm a nuclear medicine physician. I'm the Director of Theranostics and Nuclear Medicine at St Vincent's Hospital in Sydney. My life is absolutely chaotic. I am a clinician researcher and I run multiple trials. So we have 23 open trials in our department at the moment, but I also run national and international trials. When we did our very first trial, I had a guy who was dying, and we made a small change in his therapy that actually made a big difference in how he was responding. And he was super bright. And we both looked at that and went, wow. And he said to me, before he died, he said, Louise, you've got to do something with this. This works. And so we did. We turned it into a grant, which became a national randomised trial across Australia, which was published recently in Lancet Oncology. And we evaluated exactly what I spoke to with him. It worked amazingly well, and now it's in randomised phase 3 trials across the world. And so we are going to change practice. That conversation that I had with that patient before he died, about him wanting me to take whatever that was further, we did it. I'm super proud of the fact that we can have those small conversations and they can lead to big things. Research always comes from patients, or, I mean, dare I say it, family. I have a family member who had an elevated PSA and was told by his urologist to get an MRI, which led to a biopsy, which led to a diagnosis of insignificant prostate cancer. So it was a cancer that was never going to kill him, but he was 42 and he decided that he couldn't deal with the anxiety. And so he went and had a radical prostatectomy, and the surgeon did that radical prostatectomy, even though the surgeon knew he had no chance of dying from that cancer, and he's incontinent and impotent as a result of it. So I guess the whole primary trial idea of diagnosis and how PSMA PET can avoid prostate cancer biopsy by not diagnosing the insignificant malignancies came from that family member and what they went through, and they absolutely did not need to. So I actually think that all good clinical research comes from patients.